tu ni ama sa pe na kain do de le nang min chu atang pi ang se tho ta ding ai jong le ta mi channel thu in hi ang na the nai lo le ana familiar nai lo te khan leo te ni ang na the siam na bi ngon neu khat te rin tra dok bolesin ka dei. I want you to kindly introduce yourself, a brief introduction about your family background and your siblings and all. If you can introduce for the viewers who do not yet recognize or familiar with you.
Kay unaw la lian pen kahiya unaw gu kahiwa kaya pa hile sepay ana panga a pension na zong tu le tuwa kung som le sagilang hita kanu hu homemaker hiya kaniwa pat lam ka kapyanga hu zo wa hu kanu le kapana ki puyun atam zo Shillong kana opo Shillong chi lo mun tuam tuama kaniw lai zong ki puy kai na hiwang ka school ka high school ka school kai lai apat sa Shillong ma ana kiteng din in kuzowa 12 tan kang zo MBBS to ka specialize zil to hu teng kang zil zo to Shillong ma ko ki ta hi adang
Okay.
tule to chu NEIGRIHMS assistant professor po sa mo Department of Anaesthesia kasi mahiya.
Unaw bang zan ni wa no.
Unaw gu kahiwa kay atapen kay nuaya kanaw pastal hulo che unaw ni meli amad nuaya
Okay, you have the very great responsibility, especially you are the eldest one of the sibling. Napa dong hi pa taru mama chibanga doctor ta bol khiat hi mi khada ding ai
sana tum lo khiat sang jong man phazo ya
tambang hi valuable le ni man pa na hina na dunia focus ju le medical line te dia aspirant tampi ding ya viewers te ba na mun to ma zo ethnic te sini zo kampau akuki kampau hian a zo mi hian hoi abang kim do sia mi ten hi phatom ding in ka ding ta ho ja hi punya talk show at bolin medical line lam mi discussion boli ka lunglu ja eng sia le ya ma sa pe na ka pi wori le nang nani wa para i medical line mong mong na tu ama ai lo le bang bang zdana to na career ku nang su sa hi ai si tempat nang gen the dai
nagit mabangin hichibanga medical career line ka in kwan ahilole kanula kapalang side ile ka venga ka khangpi te ka school kai lai to ka high school tanazong medical line ka zilpi koi ma ka thai si tata gen le mo ang introduce ding song koi ma omlo ang guide ding song koi ma omlo mentorship pia song koi ma na omlo ahi banga hiteng tenga masape na chu pasian hoi na mo pasian hoi na to pasian thupi na ka phwang no ma bangdi chile medical line hu kaneu lai pat sa missionary na sekta na kana thei hi mo pasian na sema dinga hu kanule kapate thu get na hu zo changa ka high school la ya Catholic school la kana kaya Holy Child School Shillong mo kana kaya pute ka teacher te hile ka lekha sinte ka exposure ka muda na hu medical line na sepna mute mo medical line na se mong te hu ke pasian na sem mua pasian na sem dana kana mo kana the kana zata po thin huzo changa damlo hitang hile bigen theite to panpi theina dinga mo alain masapen dinga kana thein kanewa pat kana lunglut in at bangchi tungdinge bangchi boldinge chi te vel ho hi cha class kang pe to class 6, 7, 8, 9, 10 huzo akum kay to church din kalunglut na dungzu ya mo alam pite amale ma pasya din ko mo mi isa nga theizo ahilo le angay tu chet zong kamulo wa nga mo aman lunglut nang piazya hu kasim to church at the best kapol thei to pa mo le kasim lang ha pangain ka na panga open hu is ka school lang hile ka college kay lang hile mo 11 12 kang kay na to ahun mga step ba mo alam pingi ko mo ako hicha abula pa sa koy man hichin pele chin hitan tung di chi koy man get ata gin leng kanule ka panjong medical line ko chom zo lo di mun feel dang try chi o ahi ba kalung simta ta I knew that it is not impossible. At the deep core, at the bottom of my heart, I knew that this is not impossible. It is very much possible. I don't know how, but it is possible. So at that moment, when I was still in my high school, I think I was class 8. Then I cleared the National Talent Search Examination, NTSC. I think it is still continuing. And it's a very national level exam where you have to give some prelims, after that mains, after that you appear the interview bang phat white ta mo ka school wa hu hi bang introduction ki bol kain class 8 kahiya mo national level ang kiseling class 8 9 10 kahilaya pat sa ka MBBS zilta na scholarship kana mo Kuchi bang awardee ka na hiya, but I had a resolve in my mind. I resolved in my heart that this is not just something small. God has meant me for something better, something greater, for a greater purpose. Tsaka na ngay tuay. Hudung zuya, ka skula, ka teacher te, day sana, so pampi katanga, ka college wa, ka principal no day sana, so katanga, matin so if you just work hard, there will be some way into. I tried my level best. Lekhasim lang hapanin ka pa nga, to the point that during my high school and my plus 11, 12, I hardly engage in any social activities. It's a shame to say that I was hardly involved in any of our Zou society social activities. Kang lai te hile ZSP te vela zong mo kana kipiasing kalo because I never had the time. I was so much dedicated in the pursuit of my academic career and everything because it took up majority of my time. Hohin biyain lang chu ka neglect lo mo biyain kay lang Sunday school din college kaman lo la zong kabak kaizel mo zo janga church lang chu ka neglect lo ahi wanga society lang hun ka na piaman lo even to the point ZSP de felicitation bell class 10 day 12 pass de hu de bell zong kana lapngan ngai lo huchi bang hi it took a lot of sacrifice from that point of view yen ta ta le chumo asyam zong kahi siya but hard work hapya kana pya tho hi mo ko kang gen hun dia adang chu a step dong zu ya mo alam pi te inki hong chi ding hi
your hard work, dedication, and your motivation, even though your family prior to your career starting, hoping that you will be, you are dreaming, you really have the dream to become a selfless service, so to say, doctor line is a medical line is actually a selfless service, service for humanity. I think so. So that focus you have maintained yourself since your childhood. I think so. That makes you one of the most successful. I want to say because success in the sense of your career built up everything. So now SP ZSB had given you award, and which regarding that we have received the award. Award khanamu dani ngathia mo ZSB te nang na pia khau. National level atuan again ku talent search bang talent search no me medical line amo elu le to mo bang anana mu khai.
National Talent Search Pentu Government of India in mo UGC noi University Grant Commission noi hin KMU kumpu 2006 koma kamuin mo class 8 kasim koma kamuin huku University Grant Commission noi to encourage everyone who is meritorious lekha simlang be it in the field of science, arts, pol science, mathematics, student meritorious demo who come from different background who te panpi thei na di nga mo government te proposal UGC noi tu le tu azong om na lai tho to chu UGC noi na lai de chu ka thei lo hu hun lai ko bol hun lai UGC noi ano
How did you come to know?
Encourage
Yeah, how did you come to know?
I came to know it through. I came to know about it through our school because invitation was sent to almost every school in every Northeast. To the point that when the main interview was held in Shillong, in Northeast Center, we had students from all over Northeast. And out of Meghalaya, I, along with one more Garo student from Tura, only 2 of us were selected that year.
Okay. Nationally or only for Meghalaya state?
It was a national event and a national exam, but the competition was so tough that out of Meghalaya, only 2 of us were the candidates.
Okay.
And other candidates, there was one from Manipur, one from Tripura, 2 from Assam. So there were very few people who actually cleared that exam and came for the interview.
Okay, yeah, that's really great achievement since then. Medical line
How did you prepare for the MBBS entrance exam and what strategies you have adopted during your preparation for this medical exam?
My preparation strategy during that time and right now, if I have to compare, the exams also are different. During my time, back in 2011, the year I passed my 12, it was a national exam called the All India Pre-Medical Test, AIPMT. And it has 2 phases, that is the prelims. And if you clear the prelims, you go ahead with the mains. After the mains, then you can attend the counseling where you can select your preferred choice of center and college. But since 2013, NEET, National Eligibility Exam Test, which is also followed till now, that came into effect from 2013. So during my time, my preparation was nothing special, to tell the truth, because I neither had the idea that during that time there was not much of knowledge about internet coaching through internet, and many people would go offline coaching, like they would finish their 12th and go to centers like Kota, Delhi, or some other bigger cities in the south and go for coaching, intensive coaching, in order to crack this exam. So I knew, because we come from a very humble background, so I knew that we don't have the required resources that my parents won't be able to support me in that if I wanted to pursue this branch. So ever since from the start of 11 and 12 mo, kapag kito pa ka na pang coaching la ng kalungsima, ano omong mo lo bang di chile kila zolo di sumle pa hasa mo. Because Kecho ang support di hilaw le male kanaute song li kasig na live yun. 11 12 kakailaya hu ahit hito pa tuition bell hile classroom bela mo full concentration ali ka na simzela kana kaina chu ya army public to army school Shillong to chu army public school ki time mo army school Shillong class 11 12 ka teacher they who they are like very professional student they hildi humo medical line engineering line well it is kind of like the best in Shillong adinga who student te kumtenga high yielding questions chi develop multiple choice question bang chi practice ding hite ho exam ang pezel hute na simdiu hite na focus teu diu chi develop neu khan idea neu khan pya teu tuition wa hile ka classroom wa hile hute I try to pay my full attention and I even purchased some books which they said would actually be useful. They were not exactly MCQ books or preparation books, but they were books to help me understand the concepts of my foundation subjects of 11 and 12. That is physics, chemistry, biology, and mathematics. Although mathematics, I was really poor at that. I was good in biology, but I tried my best to give equal attention to those subjects where I was weak. And it was really draining because subjects like maths and all, physics and all, take most of your time. And I was good in chemistry and biology, so I think that was kind of a plus point for me. And after I passed my 12, I gave an attempt for AIPMT without any coaching. So you can say that I cleared my pre-medical exam without going any coaching and without wasting a year, because I got MBBS in the year that I cleared my 12. So people are surprised. They ask me sometimes, did you take coaching? I said, I didn't take coaching. So I would like to tell others too. Mi kahan thon ud mo, mi can katen coaching poi mo hi le khasim ngai hi hute na bol lo le mulo di chi. Hute hu bang maging tat ngai lo ka get ud na chu. Hoi deu ta concept na thein discipline mind na nei resources dictate na nei le hu coaching lo azong cricket the exam ko mo ki crack the mama hi to chi chu launching the mama hi mo ke jong kana launching a bang de chi coaching kana la the lo ha sa hi jang a mo hila jong kana gelching jong ke ke siam jong ka hi twan lo mo a hi wanga bange pasian lem sa jong hi tho hu zo changa I hard work tu nga jong apwa tho mo hu prelims kang clear prelims ko Shillong ma kapya mains kang bangkhada Delhi langa kanite ka kangte Delhi center kana pya in hu tenga kapya hu hun la center mains adinga only Delhi Kolkata Chennai Mumbai only 4 cities were available, so we could choose any of these 4 hu in Delhi kana tel uza Delhi mains kapya zo hu kang chingya. That was the final hitamo mains final. After that April May like counseling chichu you can choose what center where you want to study mo according to your rank dong zu yang ki han. But I would like to say that I was not chosen in the first or second counseling. I was kept in the third counseling, a third counseling tana kang movement, because even though I cleared it ka rank ko hichi siam lo mo hichi sang tuan lo all India level la ST 128 bel hu hun liding who 128 bel ka rank hin who third counseling bel ang ki han pan mo. I was kind of not sure whether I would actually be called, because college gap year ka nei lo na college jong kana join ta hua hu. But then counseling ka pa pele sitam pi om na lai since it is a national level exam reservation quota dong zu as options tama tam NEIGRIHMS la zong Shillong a zong pula hu hun la ya 2011 kum ding mo south lang a zong north a zong college tu tama tam ahi wanga nule pate de sana to inquante de sana dong zu ya Manipur RIMS ko inquante ang na de saw puja ho RIMS kana choose hukuma. So I joined in August of 2011. The same year I cleared my 12 exam. So my preparation was nothing special. It's funny to say, or should we say too simplistic for me to admit that my preparation was nothing special, but I really worked hard when I was in 11 and 12. I really tried my best to clear those few MCQs and all which were given by my tuition teachers during my classes and all. And I tried to read some extra MCQ books which they said would be.
Kipao ma tua nangyan tele Dr. Noon again tengi sili ana economical background na nei hoilote ayole sumle payasa jia coaching la zo lote ada zong hope umaya and it a little hope now come to appear that without coaching and specialized coaching and
It is really a good sign of hope for all aspirants in medical from the experience of Dr. Lhaineihoi. And the only thing to focus is to keep hard work, to focus self-discipline. Sito was from humble background, but he still succeeded.
Gipan umaya good news ay kachidinga auchi le na coaching lo ahi class 11 12 atang pi 11 12 ana na focus dia de within gat ging ta 11 12 exam kom ahi izong ki pe zel ya mo atang pi a ja hi a pen te atuk ta hai do pan la te a lo ching hi chiang ma ya ja de effort ne ngai discipline ne ngai hui le nang hi bangana chi maintain na academic session la paito wa ai le tuan MBBS exam di zong timing dakal khu bangna chi ja se na career na class 12 zong ai da pass ngai ma khoi mu ngai tho medical line tuan exam ding zong na prepare ko ma kumi khu bang timing bang chi ja sa how did you adjust that timing to complete your academic session as well as this medical entrance without losing
Year
anything
gap, no?
yeah
Kagit mabangin mo puwan 11 12 ka school kai now Monday to Saturday daily school in Sunday cha zong extra class ka nei zelo khambe we jaga CBSE board hin ka books they were all NCRT based and then some extra book jibang Pradeep amo RD Sharma mo chi well extra book khadleni hidle jong hute ko NCRT hilo mo kalai bu 11 12 kalai bu te chau kasim hi ata gen ne bu te chau kasim ho jo cha extra classes ka attend ho jo cha school ki kai chi 11 12 mo school ki kai it took like the whole day class dagya daki pan ko dali dakunta na ki topping ho jo cha tuition physics to chemistry to maths kala chemistry kala lo tuition physics to maths cho kanala ka week na hi janga hotel ka line in ka tung cha dagya ta hi sel I have my dinner then I rest for a while then I would study till 4 a.m. and then I would sleep again and then go back for class again like for the next day we'll get up at 6 or 6:30 like that and get ready for school which will leave by 7:30 or 8 so like this happened so it was literally burning the midnight oil ki chite mo it's a fact because you're so tired with all the daily class ki pay tuition ki kai uzo changa in ki tungin you really have no time for anything else I think the only time you have was on Sunday and that would be the day when you go to church and who ni changa zong extra class ka nei zelo so it was rigorous very rigorous ata tagin le mo hundang extra time mong lo extra time iloy de to pay ni chu the only time when you're free is actually when you're in school with your friends that was the time you actually enjoy learning and enjoying and then you would you would walk to tuition come back from tuition that was it that was the only time when we felt like we are doing away while science day who in life our life was so miserable miserable chidi 11 chala mo science la if we took kaloy the well arts commerce that they had such a nice weekend and even academics was so not so much burdensome we would look at their schedule and our schedule was so much packed with just books studies books who you have to be a real nerd, like nerd leha sim chau hun ipyangai, because hundang extracurricular activities ding who time mong omlo, because that time when you feel like you're free, your classmates are busy reading the next chapters or the next session. So you really need to keep up. And in order to keep up, you have to give a lot of time. So during those years, especially towards the end of my 12th, before the board, I would say you would sleep hardly 6 hours in a day, hardly. And that continued until I finished my board. And after board, whatever exams that I gave for my prelims, medical, were all those things that I recalled and remembered through my 11 and 12 coaching. Not coaching, I mean studies. So that was it.
Science student te dia science student te tough mo ya mo bo na practical atom extra class school zo chang extra class ki bon lai e jong science student kan ya ta ka thei ya medical na pe na lai le medical dia bang chu na practical projects na lai mo extra effort tam pi na lai adi mai tan na zo to hi athu pi ma ya ai le next question aga pe uri le ichi hi nang lo chinin exam first time nang zo ya ai le na course chile MBBS kun kumbangzan nang bola bangkuma nang zo khiat ma ho zo hi nang zo ku a kumbangzan na sep to ngalai mo ba probation dan mo ba na bange mo special life course te bang te na bol au me bang tan na pe to ye
MBBS kumgu ahia course for total duration no.
Okay.
Kumgu chile 5.5 years of 5.5 years. 9 hagu dan amo 9 semester Huzo aku 9 semester nang chinjang aku final exam zoa kumkhat internship nang bol. Subject somling sagi lang MBBS amo. 4.5 years academics, so clinical exposure huzo chang exam chu gi ye ko to chu a subject de akum aku ne khat changes mo to in the last 6 or 7 years they changed it. Ko hun laya who first year kum khat hiya chichu semester ni oma anatomy, physiology, biochemistry ki semi. Second year who kum khat le lang subject li ki toy mo pathology, microbiology, forensic science. So forensic science to community medicine.
Okay.
Subject lilang ki toya huzo changa third year ENT optha community medicine ki toy kya huzo changa final year surgery, gynae, pediatric huzo changa medicine. Akal kala minor subject anesthesia, radiology huzo changa dermatology chite vela hicha new khat class omzel mo. Adang pharmacology second year pharmacology is mo. To subject total somlesagi minor ni omna lai somlesagi lang kisimin huhu in for a span of 4.5 years kisimin.
Okay.
Huhu practical zong theoretical zong lab work zong second year apat patient well history well mo ward patient teba ki mzel ile zong major work bang makitoy nai lo mo nki hil thon na patient chua mo. Also chang final exam after 9 semester chile after 4.5 years to final exam kipya every year exam chu mo after every year 1 year zo 2.5 years zo exam ko chichu university board exam dalyo university exam mean who are alo chingte who next semester akai to zel mo who lai who exam alo chinglo te who hicha back paper back paper te ana pya kya zelo haguzo chang ahi wang aloi te to mo a continue review of course By the grace of God, kat based on back paper kana ni phalo ka course ko hi cha kana zo char mo nine semester kana hoi do ta 4.5 years academics kang zo no aku internship kum khat damta kang zo aku 2016 17 hita kang internship ko zo 11 na ka join 17 na ka zo 11 August ako join 17 February ako zo
5 years. 5 years. Oh, 6
almost
years. 1 year. Internship.
6 years. GDhi 6 years mo. South ho hi 6 years.
6 years.
Clinical exposure to maximum internship na bol daya. Tumodi duty vel ki posa night duty hile day duty OPD OT vel azong uzo changa ward nasip na ding community medicine vel community la no exposure inki puizelin health talk chite vel ki pyamo patient dom damlo te in ki visit study ki ball internship laya uzo aku kupat internship in zo changa bakhat i provisional certificate pen ko license mo medical license ding ako ki register
Okay.
Manipur Medical Council ki register mo kazona izo na mo na ki register ko
Okay. To no achu license number na nei chat diu ya mo.
ki nei chat
Kum pen pai
i
soi ta
practice
mo to.
pinanga ku zong renew ngai zel mo state
Okay.
khen kha da ku lifetime hi Manipur notice atam zo ka the te aku 5 years aki renew zel
Ai le na
Delhi la
Manipur ai le.
la ko
Renew zel
lifetime
ma. Manipur ai ya mo.
Manipura hi nahi wanga kana hengi ola
Okay.
o te heng te you le
Megalai
specific
ana
la
hen.
iring te
Okay. Ochi le hoi be ma hoi le. Ai le final year zo wa practical ku real dan ni ming te no dissect pel na bol hi ya mo.
dissection ku first year raki bol anatomy subject amo
Okay.
dissection ku cadaver ki chiven cadaver ku cha dead body te formally nana ki koi mo amwat ko na nga ute ku dissection ki bolin bakhat mihingte skin apat athagui asisangui apat agutan abona anatomy mo bang nerve bang vessel chile artery vein ahilo le hia ikuta jong muscle bangzat ome ithagui bangzat pe ye chite vel mo geography sim baga de thei abona anatomy chu haing luta ta changa bangda hai chile atam zo hu Latin to Greek ngen tang Greek ham ngen in so changa you just have to memorize you just have to memorize it nothing there's no way around it like for example
no bypass ti dan
nothing because body hi changa le tumpia hoi tengmun any country you go anatomy who you just have to by heart it by know it by heart like for example like if I have to say in our hands we have iso who radial nerve radial artery kichi who gaya who bangza structure ome ahi lo le ya ikhuta muscle tam piom vele ikhuta zong tenga hilanga muscle min bange hi tenga muscle min bange cha this simin mo ita ibri na zong skull ba zong ilua zong gu bangza ome spine gu bangza ome hu chang hu gu tenga zong muscle bangza ki attach muscle te min te vel zong ha sa iza kha ngai lo chi te vel mo you just have to take top ngai by heart lel ngai there's no way around it who first year chu hasa thoma hasa body first year dang anatomy ha in who just have to memorize bang aha dan kang den de first year kahiwa ka first part completion exam kaniwa hicha part aki pe level i body ho hicha upper limb kitchen I khut teng hitan mo uzo cha lower limb ikeng teng uzo changa I head and neck uzo changa abdomen thorax ji I mean part part khat izo changa exam ki main first exam ka nei wa hu mi za khat la hu me somni well chau pass. It was a huge blow to everyone. Pass nang azong 100 la who 50 above mo ngai. Like student hizat la 50% sanga tamzo na thi changa chau na pass din. Who in first part completion exam class la wa mi za la who mi somni chau ka pass on. Who so ajo we realize alekha simdan mo to amabe. Na by heart pop ngai na by heart lo le nang medical line na ki ho thei lo le ya masal bang om pe chi na thei lo le na bang chi hilding la na bang chi simding la ho wa le ai lo le ya thau pe ya ingonga bang bang ben pe ko te na thei lo le na bang chi simding ye medical who in body human anatomy ma ki simin mo interesting tho thano bhai tho ahi banga a memorize a recall depend ko mo lung sim hat ngai hu
Simhan ngai ke effort nei ngai wang tu dia resilience hard work ngai mama mo memory
ya ngai
on pia ngai effort ngai a entrance za mo pa sin na doctor azil ta ai dan bazo se liang kan lo mo dan chu
ni kan lo
pula
kan
para
mi
mo na
tam zo hasa se sing sing a zo atop zo om bi ka batch la wa mo
okay
simpay no lo hasa sa on mo
so thau dia mi
aging tat bang no lo
mi
aging tat bang
family background hoi deu te bang tu gen thei ki samo deu mo
ke thei ki sao le atam zo hu
pe
tingin tangam le
pe
kai
ya
zo
bangin training
zo
do
jo
lo
mi
time
hen
ba
khat som phya hi ta subject khat pass zo nai lo chi zo om
okay lo chi giống mo nên là
om
phổ dấu vào chỉ là
hule zong hute khutwa NMC mo MCI rule dung zu ya attempt hizat sanga tam zo pya thino lo di chi bang rule ngom ta mo 2018-19 la ngom
to
kuma sanga chu mi ken
Bangladesh
khate
Bangladesh for
to
thế
chu live chau attempt pya the chi dan deu khat rule abol we ta live ta na pya na pass ngai te te ahi lo le na top di chi bang om
okay 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 tamo
kuin alut teng teng zong alo ching hi lo mo
no
that is just a ticket for you to enter this this field.
still thì nó
But
license này
later on, you still have to give double effort, double work.
nó rồi chết doctor
Hasari.
ya para to ai thì to đi là chú medical chỉ mo ba nga effort tam pium hard work ngai na lại mà giờ ko rồi thì này đi nga doctor imin bula di doctor ang kiel na depend tu niam hi lo chi na tu hai do ha pa ngai ai ya lo le le ha pa ai pa le zo la om ton lo chi hi me mo to ra na mo na semester ra khat zong a back subject ne lo na na zo to hi tu pi ya mo ji dan mi ko ton ta ma ne ya ki pau ma ai le to a nang na training sung tong to mi ta le nang zo khia din certificate nang nei khia zo a specialized course na bol o may ba o mina na bol ku bang department na la au za ku bang ja na chu zai ai
Um, MBBS kang zo who subject tam piom kaget ma bangin mo masa som le sagi lang o ma specialist na lao le option tam mama huzo chang 12 bakhat MBBS ka pass zo wa hu ka interest zong tama tam bebe hilang pailen hichiding internship bo zo chang bang chi bang lifestyle e ide bang chi bang patient e imuding e chi bang neu khat chu at least 40 to 30% to exposure ki ne tabla hichibang branch like for example gynae laleng hichibang patient omding hichibang situation om mai thei me his zada patient ki ne ding his zada ki boiling chi ki mo tabla adang hile pathology lang laleng lab work gen tang ka bolding patient te to interaction tom ding ahilo le radio kalale dermatology kalale hichibang omding chi te wel mo who that to new had idea ki ne tabla who in kalunglu na chu medical line hiding in patient interaction tom lang ka dei ke patient interaction tom ka chi changa medicine hi lo le surgery chi te wel kana lunglu khol lo mo kana dei lo hu zo hu ka interest ta ta ka thei na nga kum khat junior residency kang bol mo ya NEIGRIHMS sa ortho department na clinical subject hiya ortho department na junior residency kumkhat kang bol in who kumkhat kang bola who I realized that clinical subject to a patient at inpatient to committed obtending operation lang hile hu che ho hu kalunglu ta ta lo cha kang thelo mo kumkhat kang zilla hu kang thelo chu I would want to be a doctor with with not much patient involvement mo patient involvement ka day sing lo hu so changa me treatment pedi hile song long term treatment chi devel like for example medicine tia hu long term hi cha mi anat now ki bangin hazel song aphalo song hi cha den chi devel mo hu devel ka day lo in lung sim kha da chu kana ngai to le pathology ka la di cha ka da ngai da bang di che lab board be ka lung lut mo lab board be ka lung lut din ho za changa night duty bel song ka day seng lo mo pathology vela night duty ho frequent seng lo la clinical branch to tia huin kumkhat junior residency kang bole specialist zilanga ka lekha sim ta ngaya sim ngai hi cha kang thedoi kumkhat gap year kala mo kumkhat gap year kala specialist zilanga Guwahati dem sa coaching kala zo aku kumkhat kala zo aku counseling exam ka pya zo counseling kang bola aku first time chu pathology kala ahi wanga ka incontinent pathology na la hu sangin mi ethei na branch de la tan ni chiwo mo inule pa te zo bang ma thei lo wa ga doctor chi le mi ethei te ma lao ni chiwo cha ko inte ke ka no le ka pa ko mi ethei te ka de lo ja pathology ka la so le ka chin in a subject branch ka kwai mo ka boy bo chi tu inule pa de sa to amin ke interest lang to amin atop na kang ngai to le ka pathology jilo adang ka dei chu anesthesia zong hoi ka sa bang dia hoi ka sai ka chi le patient zong there's some patient interaction patient te zong TNV and you don't have to deal in long term with such patients more you will see them for a while and after the surgery if they are doing good you don't have to see them again after that so adang the subject deals with pharmacology in damdoi lang mo pharmacology physiology so it was kind of a subject which really intrigued me I was exposed to it during my internship and I really liked the professors and the teachers who helped me understand the subject it was just a 2-week posting but I really liked the subject then at the time so I chose to get anesthesia who anesthesia kana la hu pathology kala zo wa hu the next round counseling of kya hu anesthesia kala in anesthesia ka pace was anesthesia kala hu Uttar Pradesh Allahabad Prayagraj ki chimo to hu tengmu na hu Motilal Medical College hu anesthesia dinga selection kana bol kumthum course hi post graduation song 2019 kumaga join was a COVID intung 2020 21 COVID ngomin 22 akazo ma kumthum kumni phya chidi because mid year his join hi kumthum ila zong cha overall kumli bel tung zel ma
okay
2020 21 lai anesthesia branch ko branch de ko COVID kuma ko tam pitang ki thei do mo kunda nga ko cha ki thei kol lo en huwa ko ICU lang hile damlo te hile hote et kol na dinga ko branch te ha zangang ki zang mo huwa ko ka branch ka la pen ko apoy mo dan hu zo chang azata thwai ta chi kang thei dia dia hu zo ha hu ba sanga chu hi cha midang in zong thei khol lo mo world media ten zong thei khol lo bang kuma tang 2020 kumaya Times magazine COVID kumahu a front cover aku anesthetist hat mo PPE kit wa COVID kuma ya doctor tin asil teo mo kwana PPE kit kit chigan te personal protective equipment kit mo hupen still ako amil mask to cap to mo amil do pen hu pen full Times magazine at ko hu bang jai chile COVID kuma mi tam si seng hua hu anesthetist te hu patient to anai pe na om pen pen mi dang ten azaw le branch dang ten koi man nai ngam lo le patient ai bang ko branch te hu it was like the frontline warrior treating me hun lai mo hu zia zong ka branch akang interest de to chu ka branch ka dei bot ka lung lut bot ta in 2022 kuma kang join huza ko UP gaba bon kumni kanese lo compulsory mo bo kumni UP gama ya Lucknow mo King George Medical University noya kangzo hu kangzo bon compulsory bon kangzo no Shillong ya NEIGRIHMS Department of Anaesthesia senior resident kang continuing kumtum kangzo no ko to ka present designation mo assistant professor pe ko interview ki hongin hi pena ko launching na kamu ya tuta na diwa. It's a very long journey, almost MBBS ipa dapat sa especially Zotan almost 12-13 years. Very long and arduous journey. Gimway.
Yeah, mo long journey tham lo bin COVID-19 lai bang adong chu bang tane khat panna la ji china mo ba koi ma thei kha lo bumi lai bang sa tho ti ya mo bang na ki manage we bang tang pi a cha am te ho COVID-19 lai bang doctor te tam pi an boy pha zom bele mo lai bang in bang challenges ha om tho ve bang tan na risky om tho ve bang tan na expose ka we bang pot bang na chi bol wa bang na chi ki se we
N95 mask PPE kit to N95 mask mo wow ama sa jong kinathe lo ze na ki sem hunaya in la gamla hunaya travel restrictions on tam ki mo travel thelo bang regulations ngai vaccination to bang paperwork tampi ngai mo utevel I mean ipi kapiji bolai jong ya hi tenga mi damlo teng to ki I mean ina inule pati in kwante I mean ki dam na la bang tat ki dam dia chi te vel jong thought process ang na ha mi tampi alelin mi tampi asiyom na the ICU bang lude hilang left and right patients are dying. Most of them are dying and just few of them actually survive and go back home to meet their family. Especially UP Gamachu population tamin mi asiyong daily mi si daily mo si tam seng ingay to le jong to PTSD dan deu kane chichu PTSD chichu kangai to le it's like that time was so difficult mentally spiritually physically so exhausting gimway in me see daily me see mula jin na lungsim na moral then down the year even though you believe in God to ya asiteng ko atamzo pasyan thelo ngentang gusto changa mi agay te loy jong mi tam PC ji bang jong omin mo personally ka family azong kanao jong khat COVID ja serious hoda no min mo agay lai but anesthesia branch critical care exposure kana nesia kanao jong serious ta ICU apply azong I was able to assist her to the best of my ability in the year 2021. It was a very difficult time for me, but for the glory of God, because I was in this branch, I was able to manage, help her recover, and God really worked a miracle in her life and in my life too. Me almost to the point of death tezong mo dam sianga kamu mo ulay ho na India pumpia leitung pumpia mi again the bebe ole koi mi khen khat bang ain kwan wa be lu mo chi te bang om hi changa hu hin hu kuma hu ka branch exposure kan na neza ka branch kan na lazong ka ki pa ma in pasyan ko at pa tulan get it mo hu hin ka branch hu hi cha kang dei deu chi di ha sa le zong mo because we see
Really,
death so close
you're really a warrior, the frontline warrior, as the saying goes. That medical officers, medical staffs are the actual frontline warriors during COVID-19. Many apprehensions are there that there is no other option but to at least survive. I have to survive myself. That already has been adopted in everyone's mind. But you selflessly serve, and you have mentioned about one of your sister. You have saved her life. You are really a lifesaver. I think so. Even though it's a family member, it's saving a human life. It's no less than a great achievement from your end. So I appreciate you for your great effort especially during the COVID-19. Ipaw matibang effort na namneya nang hin narong risk nang hin na di risk lung neo ay thau di ngai jo jai kang do hile tanana na pantowin na career na pay to piin lam khara eding ile to adana lung kya top san ele idam na le khono lo cha zo di mo lung di ai jibang te zong pa na nang in na
Avon and overcome Jen salute kang piahi. The anesthesia branch is so much special that without their consent, any procedure or any operation could not be start. So need their clearance.
pre-anesthetic checkup
Anesthesia tiền hay đó check rồi check okay nó document yang mo nang okay ya mo oji ya oja anesthesia hi special mama ya na so zo anesthesia sa izong le nu ni inui pate molten chu doctor tata medical officer hian lan medical mo me le chi kan to special course ki bol na hi amount available thei loi ja o te chu explain tho le li tan mo zo ile maba na to ai le na multi speciality course te na pay to pi so me ai lo le mo bang na career chu nang danini do you have another step to go further above all this career you have achieved mo nang apara
tu le tu achu ka set na pe na chu thil tampi research bol di zong om na lai se bedding zong om na lai tu le tu achu zil bedding chu om na lai. For example, we can go for further fellowship and fellowship ilunglut na lang mo cardiology lang cardiac surgery mo or surgery om te zong specialized field lo ma neuro lang chile brain lang surgery spine lang surgery chawa dinga anesthesia zilding heart surgery chawa dinga anesthesia zilding ahilo le ya pediatric naupang lang te chawa zilding chizong omin adang tu like transplant zong om tablet to like organ donor organ transplant chitedel om hitain mo hutevelas di zong specialized branch atwa ma zilbeding zong om course omin kumthum course kumni course kum khatte zong om mo uzo changa hute lunglut lo hile medicine lang ilunglut hile critical care medicine lang zong bol beding om here ki zong kum khat certificate course kum khat fellowship dan deu critical care kanam bol hiya mo intensive medicine ki chia critical care chichu ICU mainly ICU adamlo ventilator adamlo a system thing failing mo all the organs are failing hichibanga patient demo manage dan huzo changa to bring them back from the ICU to the general ward chi hichibang course ko kum khat kana zila Lucknow mo King George Medical University hi extra kana zilbe here beyond my MD anesthesia. And there are more things to learn which I'm interested, but at the moment hute tule tu achu kaki prepare na like a pursue na ilo zilding
ai le ki pau matwa nang gen le medical line goi loen education le bang kimzo sai there is no limit in learning, and you are
yes
really you are now a respectable, and what you have achieved till now is no less than
A success story already, and you have achieved many in this medical career of yours.
become that much successful, I think. And now, above all that, you try to pursue more knowledge and gain something more and become one of the most reliable medical officers, uh, like the when in any field, in any department in the medical hospitals like multi-specialty hospital, there is a consultant. I think there is consultant is one of the senior most and reliable and effort for further career. I want to say it's really a good sign for all the aspirants. And before that, I want to come
Go
back
back to
basic for all those aspirants that what you have achieved has been great, but can you make or how should they prepare from the basic? Some basic of yours can be shared to some aspirants of this medical line. So can you please share your thoughts or your valuable advice to those aspirants and how to prepare and how should they uh,
how should they prepare and make their dreams come true and become a medical officer or more experienced and successful doctor in their future.
no career wa nang dang ni khat be ang suat hin ding un lai sim na lai te to aspirant tampi in anen te la ding in mo ne khat nang yan le tin nge nge
medical line who career it's really long. First of all, I would like to let everyone know who are aspiring to go into this branch and this field. Kageduchu, of course, kusaw hin. You should not think that MBBS kabolzo my life is set. It's not. MD, MS kabolzo changa zong life set hitwan no. You still have to struggle to become an established consultant. Kuzo if you want to go further, nadzil beding na una lang. So super specialties ang tuwa ombita mo. Lang specialist zong tampi kibat na lahi. Super specialist gendi mi Amy zil tulad tuwa mi khat mi vel chau ka thei hiya. Adang who gamdang apele mi patient te ko super specialist te chawin at time state dang vela mo mi changkang tai izil na jong sangdeu deu simding jong tam piang hin at first sakaget uchu alungnu pen chu it's a very long journey and you have to accept that fact. You can't say after MBBS my life is set. It's not. You should not be just happy with that. Who in 11, 12, but hilay maka day hilay maka lungut hicha ud na tata na nanele. You have to be very sincere in your studies. And nowadays resources are available. Sumle pa sila zong coaching books tebel tampi tahi mo. You can get secondhand coaching books, notes from online and from very good coaching centers. You don't have to physically go to there, but you can attend online classes. Some of them come at a very cheap rate. Some of them are affordable. Those who are economically background hasatezong, you can still study and clear it. I would like to say that. No, you can still study, clear it. And the exam now who to ako need exam kisita 12 zo changa kipya. To need pen who overall aims lang institution na day lazong 680, 700 plus mark na mo ngay mo. Nozo changa Amy lang te putule tua o ST reservations of on the line, new card relaxation seat quota vel zong aphatwam na kitang nalai mo huin lunglut ta simulation mo it's not a very impossible task. You can achieve it and you can do it. And then after you clear it, MBBS na clear Zoa ho, don't just be happy with just MBBS Zota. To like MBBS Zo may tizong ang pazo nga patient ed dan surgery bon dan chite zong bang mate follow. Because training zong hichitan hitain mostly theoretical apay kita mo. Huin kumkhat mo kumni mo hicha training tata MBBS zo amin edu tata le kumkhat kumni hicha training tata na lunglut na lang ano bol ngai. Otherwise specialist na zil ngai te specialist ko yakon bangzong branch hilezo. Anatomy may ahilo le physiology may ke hilezong pute azong specialist branch bol chinzong medical college teaching line academics oi mo bebe hi huchi bang branch te ko tu lai sit min ala chang ako tamzoten sit o nga pazel bang di chile mi tamzoten kumi et na lang cha odego mo to ya foundation branch anatomy physiology biochem patho micro chitevel ko foundation of le hite foundation ako ya clinical mi et na lang branch te kisyama vela who in medical college ako MBBS first year subject te hilding mi of lo le asang lang te zilding mi om lo mo huchi hin hichi bang branch te zong asset to ansi nalunglu to le the sky is the limit even in these non-clinical subjects sumu nang zong tam bebe pharmacology bolted dia in big pharma companies then contract PPF they travel a lot, they earn a lot of money through big pharma companies. So pharmacology subject chite vel zong simmo hoi mo branch tang te zong we at na te chau in sum lo the branch bang ten zong sum tam pipi alo be sum lang lo na lang alung lut te tinga ke ko ai lo le a subject mong day alle khasim lang mong day te adinga chu khat pen lao le chen zong bagma siat na om lo who specialist na zil zo zong for example surgery specialist na zo in surgery apangay abona kabol thai bebe ahiwanga kalunglut lang neurosurgery brain surgery kalunglut hi na chile kumtum course om kya vel mo MCH ki chizel in hote om neurosurgery mai kalunglut hi neuro lang chaw chile kumtum course labe kya ngai huchi banghin simding chu you have to continue that study attitude mo zil beding that ever learning like a child learning mo who process who a continuous aping here tule tu azong even though MD ka zo kumtum ka course zil azong I was continuously preparing studies academics and all tule tu azong we are teaching postgraduate students mo class well palazelo amatia patient etcho lawa lekha sim patwa mo academic research patwa na kisim na lahin ka na kis to MBBS na zil zo changa specialist nang zilding specialist zo changa ku you can go in 2-3 directions khat ko hile academic research to kabol na banga mo mi zong patients of the academic zong na bol khat ko hile research mai to ya damdoi clinical trial chite vel mo cancer study chite vel puti research mai azong mi lunglut pay om mo leitung pumpia mun tom ba zelo university tom research conduct abol zelo mo hute zong khatom a second research hitale a first academic lang hitale patient etto a third na hile practice mai bol di mo na sekdingin sumtam pp loading patient tom te etzel dingin mo hute huhin adang hile option ni om kya hile government setup na nasete private setup azong na nasete mo government na nasibla chu na salary cap om mo chu hisanga tamzo increment government te thuwa hi adang private hile sky is the limit na uzat na sub na lote na sep tamle na mutam chi bangin corporate to like corporate city la azong corporate oma corporate te ko salary alag ka mo asyam tata te amo not just I'm not talking about just clinical subjects like medicine or surgery or gynae or pediatric no I'm talking about all the other subjects like for example community medicine and tezong bangin WHO backed fund Bill and Melinda to Bill Gates fund chite bang omen mo ute community research on tom bol deu COVID na thang pe chang azong research bol tha chite vel who lekha sim pen who ki haswa thelo ka china ho top na humo ni khen khaten medical line alunglu do ko sum tam pilo thena ti alunglu do la adia MBBS kang zila ka the pan kaloi khen khaten tu medical line kala ko sum tam pi kalo thena nga kala hi achun that's why angzil zo changa sumlo di chaw alung sima omo mo khen khatte hi le kalunglut mong hi a subject ka de che hote velin lunglut na patient et chi te vel lunglut kya lo mo huin ilunglut na dinga branch tam pi om no ipe na lang to am to om radio radio MRI CT scan sim te vel no patient et lo pi atata mo test vel intervention vel about chang chawa patient ke to interaction am atam zo computer room MRI room a on scan vel et to ultrasound vel x-ray hi lo le CT chi te vel hin huin nalunglut le MBBS na zo chang multiple options na pe na dinga mo hudung zo ya zong na earning capability and potential zong atom tom ngom hin it's a very long and arduous journey. It requires a lot of dedication and time. It will take away all your nakhanglay hun sung chi di mo nakhang dong hun sung pu abona ala be ding hin mo ku ja hu alunglu ta te ading chu bakat it's a big decision uzo changa mi khen khat te MBBS wa zong alunglu lo zong omin they change their branch and go towards UPSC and UPSC based on me tamatam tulatuan tu puma UPSC topper zong he's a doctor from AIMS Jodhpur Amazon AIMS medical line bang na la anu le pat mang nan line hi wanga Amazon medical branch chilo UPSC IAS di an ud botte mo huin kagedud na chetten UPSC zilte zong medical line background tamang hatam mo lekha sin 800 rank mo manipura pa ka junior ka MBBS junior te now pa junior Amazon jenium sa MBBS na zo khat student hin kathida na jenium sa ana zo hin huin MBBS zo azong especially zilpai singe UPSC lang kalunglu hi lole government kham kalunglu chila sa ka MO medical officer zo option zo ombe be mo asya bang ma om
again nung ji ha Mother Teresa te lo na hin kwa mi gen thei te mi pan pina le mi mang che Samaritan work sa mo ana mang bang wa hi to doctor azong hi akiba na ga sa hi yu ja ke view ka gen na hi ke view da na mo ka gen no na ka gen ya athu pi ya to ta na ne chip te ai le to na gen na now pangte hoi do medical line a pe uten hi to basic negen teng hi ana zui theule de uma to bana mabana hi hizdan do ung pe to le doctor me MBBS me ni bangma availability ma bang chi dia ai lo le ma hi zatan na nga ding bang mo le chini ama non loading karang sim tain specialty banam multi specialty bana super specialty to aina nang dong mabana dan oi doan gam sungla jong tuan e chip teng bana adang dong e chip to le chin chi kang de sa tu kang ge ni wan tuale what particular scope they have to focus is it the chemistry or biology or physics which is their main subject they have to focus for this medical line
physics chemistry biology athumwa equal weightage
okay
NCERT notebooks are the standard
okay.
NCERT notes chilo adang chu thekol singge
Okay.
question paper need aki sette hu it's clearly written there ki NCERT concept ki form he mo who a student they a concept a strong le they will be able to clear it early
Okay, good. Umi higa tang pia mo. Lai as to aki prepare zong dia mo tu le tu ang 11 12 sim to da ni 11 apan pan le zong chu zo lai ton lo si nai chu khar khan chu 9 apat to coaching
Ah,
de lumin mo ya akas si
mm-hmm.
pele yo ma mo akas bang
Akash
nai pai
tutorial
ya
bola.
nang ka
Akash tutorial Ellen to titigel abin thangbe na ka the Akash to Ellen.
okay coaching chu job le hoi ma tho mo job zo le mo job zo te dia
Coaching job le zong hoi ve. Coaching job le chu hoi in competition to like sang tai no coaching bol thei ten chu bolu le. It will give you an added advantage compared to your peers so that you won't have to waste another year or akuma mo kung bailawa. Kizil laiba nga kaloy te ya Imphal Messi coaching at si teo mo. Akum li na amu po zong mo ka batchmate kin hatte MBBS ka zilaya. Huwin ana days yawa kumlita na ala coaching bolon. Huzwa ngel ching pano. Huwin coaching la pangta talajin kumli hilaw maybe in the first year, in the second year anang clear theo mo. A journey mo sao hin clear by the sao pikitung thay.
now we would like to conclude this discussion with Dr. Lhaineihoi Zou, especially aspirants of this medical line, and I hope it will make impact and benefit someone for the entire career. Now I would like to request Dr. Lhaineihoi to kindly make some tips and
What character should a doctor have to be a successful medical officer or a medical practitioner in his or her entire career?
medical line te ading in tem khat advice mo na tips chinie mo tips ne khat nang pele
Personality wise, you have to be empathetic. Empathetic to me, gente ni hasate kisam na apoy mo mama mo. Because who na hasate patient hasat na nakisam janga, you will have that inner desire in order to help them better. Who khadahiya. Secondly, you should always have that urge to keep on learning more and never think that you know it all or you have learned it all or you have seen it all more. And the attitude to keep on learning more who apoy mo who you have to have a very strong mindset. Strong mindset because training mama zong gima physically draining night duty bolte ha sabe imut khamlo ni omdi atay ma anne hunlo atay ma imulo na hinda chu hela health hode who you need to have a strong mindset mental attitude more it has to be strong ali na hile you need to have a complete faith in God sidimo ni ken khatte adinga chu it does not matter but ke adinga poi mo pena ko poi chu itil na septe ko mo amin may struggle de hilawa pasian mo ko mama ipasian dia pasian ki pana nga mo til ibol thai ji apoi mo at dang hi le dam theina ang petu ipasian dam theina ang petu hiya we course zilu tampi omin dam lo na zia zong top zong hi tampi om tho hi mo huin dam theina ko ya poi mo health mo good health is very important who teng hi wa we get at least 4 to 5 mo 4 to 5 points ba get it adang teju branch dang to beva you still have to work hard you still have to give time in order to be successful in every branch you actually have to hustle a lot it's the same with this branch also but besides that you need good health you need to have a good support system kachichu be it your spiritual support be it support from family in quante friends more because every day you will not feel good some days you'll be so tired and exhausted. So you need to have a good support system and a mentally strong attitude and an attitude to always learn, and to be empathetic towards the suffering, no? Towards others. Yeah, this kind of mental attitude and personality traits will help you to get a long way.
Lastly, I would like to request Dr. Lhaineihoi to kindly make available advice and how to all the viewers and make this platform fruitful and available tips to them, to all viewers and subscribers.
Hijibang platform nang chial zong pa puman hila zong kana bangkat kana utseng lo hin ahibanga kana utseng lo chichu. There are many more qualified people, more experienced than me who can speak on this topic, but hijibanga opportunity platform nang pia ko student te tamzo mo it's medical line na lunglu te patwam na ding platform nang pia zong ang patu kang get mo puman, because YouTube platform a real experience nis te ko nga mo experience anazati na dinga hijibanga ngai ko na poi mo nanane ja zong na channel dungzu ya mo ja opportunity nang pia zong katipa adang hile hijibanga platform mai lang huna zong na channel dungzu ya mo mi atam zo ai mi hang no te zillai te atwampi mai lang huna career focus lang hile hute career focus lang ho chang zilla ding lang focus bol na tumzong mo kang appreciate mama ho chang mi hijibanga talks pe ding te zong mo diversify le chin branch tuan mo hucha bole olola i branch pe na cha ta asang pi tung zo le hucha in nam te zong khang to ding mo e te zong ki khang to ding hi mi dang te zong ba khathi na ding na platform dung zo ya mo udinga tang bang chi ding all the best kan chi oti atam zo ngai ten like subscribe and bange share thwa mo ni atam zo te platform mu the na ding tang chi oti den
Pauma, platform bol thitana ki bole ya de ki pauma Dr. Lhaineihoi Zou, Dr. Lhaineihoi Zou, banga hun lemtang nang pia valuable advice zan nang pia te na ne satu bana aspirant te hin medical line hin mizosia atang pia mi channel en zosia in patwam pi nge jing ka jing ta nang zong number 1 na career ang lot sing wa chin position dam nang pen lan isang tang zo le achievement hoi zo muding in
Namaing puin umpijing tahen.
ki pao me puman